Today I'm going to speak about perioral dermatitis, which is a fairly common acneiform, somewhat rashy condition that occurs in women and children. So let's get started talking about perioral dermatitis. Well, here you can see a woman that has an acneiform or an acne-like eruption around her mouth and nose. So perioral dermatitis, what I instruct my patients is that this is a somewhat rashy form of acne that occurs in women and children. Let's take a look. What it presents is small acne-like bumps with sensitive skin. So it's red and scaly, but it's also studded with small red bumps, sometimes pustules. Again, it's important to know that it's more common in women and children. In fact, it's rarely seen in men. It occurs around the mouth, around the nose, or around the eyes. So if you have a patient that has a red scaly rash around the nose, but has scalp involvement or ear involvement or eyebrow involvement, this probably isn't perioral dermatitis. It may be another condition called seborrheic dermatitis. The etiology is unknown. We're not sure why this happens, but it's probably hormonal in nature. Well, often when people start with this condition, because of the red scaly component, it's treated with topical corticosteroids like hydrocortisone or maybe a prescription strength cortisone. Unfortunately, that tends to make the condition worse. The cortisone, again, we're not sure how this happens, but a good common sense way to think about it is that the rash and the bumps are a reaction to the normal skin bacteria. When you use the topical cortisone, it suppresses your body's reaction to the skin bacteria. Once you stop the cortisone, your white blood cells come back to the skin and see even more bacteria than there were before, therefore causing a flare, a rash, and then improvement with the cortisone, and then a flare cycle. So avoidance of topical corticosteroids is important when treating perioral dermatitis or discontinuing them. Topical cortisone nasal sprays have also been known to trigger perioral dermatitis. So when you treat it, you have to kick the steroid habit. Again, if it's around the eyes, usually this is a secondary presentation. So it starts around the nose and the mouth, and then eventually we can see it around the eyes as well, presenting as small acne-like bumps. Well, here on the left of your screen, you see a woman with perioral dermatitis. And let's contrast that to a man on the right of the screen with seborrheic dermatitis. So they can look somewhat similar, but importantly, this man has eyebrow involvement. And if we were to be able to see his ears, he has a similar rash in the ears, as well as a dandruff-like problem of the scalp. So seborrheic dermatitis is more easily thought of as a dandruff-like condition that occurs in the eyebrows, the ears, behind the ears, or in the beard distribution. Whereas perioral dermatitis is a rashy type of acne that occurs around the nose and mouth in women and children. And again, here we have these two conditions contrasted in written form. Seborrheic dermatitis, we can see it in infancy, but the highest incidence is around men, more so than women, but around the age of 40 to 60 years of age. And again, women and children in perioral dermatitis, the scale is somewhat different as well in seborrheic dermatitis. It's more pink and kind of an oily scale in seborrheic dermatitis, whereas the skin tends to be more sensitive in perioral dermatitis.